And once again, a very warm welcome to all of our attendees this morning. Just as a reminder to all of you IOPSA members, those of you that are in the plumbing industry, please don't forget that our OPSA is inviting you to attend the Plumbing Industry Awards. This is happening on the 28th of July at the Royal Elephant Hotel and Conference Center at 6 p.m. So if you want some more information on that black tie event, please contact marketing@iopsa.org. Now, we have mentioned this before, the tips to continually prevent COVID-19. As we saw earlier this month, COVID regulations are still in place for companies. Now, based on your risk assessment, you will then put in practical steps and protocols in order to try and prevent the spread of COVID-19. You also want to try and prevent other types of diseases, as we mentioned. So looking at things on washing your hands regularly, if this is not available, still using an alcohol-based hand sanitizer. If you haven't washed your hands yet, try not to touch your nose, eyes, and mouth. If at all possible, if somebody is sick, try and have social distancing or avoid them. And then cover your cough or sneeze with a flexed elbow or tissue, just very good in terms of hygiene in any case. And then cleaning and disinfecting frequently touched objects and surfaces. And then also every company should have their own policy on vaccination. So we have mentioned this before, incidents and accidents happen continually. When it comes to occupational diseases, there is no difference because we do not know when the spread of certain diseases or bacteria or even the hazardous biological agents that we are working with within the plumbing industry is going to impact our business by infecting our staff. So take a look at COVID-19. I know you're tired of hearing about COVID-19 and you want to break free from that. That's fine. 100% all of us feel the same. We understand how you feel. But let's try and still use these principles, these protocols to help prevent other bloodborne, waterborne, airborne diseases that might affect our employees. A sick employee who is off from work is not productive because they are not working. So health and safety, even preventing COVID-19 by using these protocols, helps us to increase productivity by keeping our staff safe and healthy while at work. So this morning's Toolbox Talk is on completing an Annexure 1. Now, it's not a very long Toolbox Talk because we're just going to go through the basic 4 parts of what an Annexure 1 is. So let's start by explaining the Annexure 1, why we have it, and then how do you go about actually completing it. Now, we do have a copy of this for you, but if you just log into Google, type in Annexure 1 DOL or DOL Annexure 1, that is Department of Labor. Normally, you'll see a PDF version comes up. Please just be careful on downloading anything from the internet. Make sure on the top left-hand corner in the HTTP address, you notice that it does say .gov.za. You don't want to download it from an unknown source. Obviously, with not just normal viruses like COVID-19, we also don't want to have any computer viruses that could affect our hardware. So please just make sure that you are downloading from a safe website. If you are concerned about that, send us an email, safety@iopsa.org or info@ohss.co.za, and we will then send you that document that we have received from the Department of Labor. And obviously, we do scan all our emails for viruses, so hopefully there's no issues there. So our safety thought for this week is prevent incidents by planning ahead. So you might not have to complete an Annexure 1 at this moment. In fact, our hope is that you never, ever have to complete an Annexure 1. And the reason for that is an Annexure 1 is there to record and investigate incidents and accidents. Now, in accordance with your General Administrative Regulation 9, the government wants us to record and then also investigate any incidents. So let's just go through the 4 parts. It's 4 sections, 9.1, 2, 3, and 4. And then each part of the Annexure 1 to identify what it is, what you need to do, and why is it so vital for actually doing this. 9.1 says, an employer or user shall keep at a workplace or section of a workplace, as the case may be, a record in the form of an Annexure 1 for a period of at least 3 years. All right. So there we have it. Every Annexure 1 form that you have, must be kept for at least 3 years. Why? This is for all incidents which he or she is required to report, first of all, in terms of Section 24 of the OSH Act. Those are recordable incidents and notifiable incidents and accidents. So Section 24 of the OSH Act says there's certain incidents and accidents that happen at work, things like somebody getting amputated, somebody falling and losing consciousness, a part of machinery exploded or came apart and resulted in flying objects, somebody died at a workplace. All of those are reportable incidents, and that is covered in Section 24. So if we have a Section 24 incident, you must have an accompanying Annexure 1 form for it. That is to record what happened and investigate what happened. The next part of 9.1 says, of any other incident which resulted in the person concerned having had to receive medical treatment other than first aid. So if there's any other incident, so the person was injured or they got sick. So even occupational diseases are covered here. So if the person got COVID-19, if the person was exposed to a hazardous biological agent, perhaps they were exposed to some sort of hazardous chemical that you're working with and they had a bit of a reaction to it. They had to go to get medical treatment. If that is the case, you also have to have an accompanying Annexure 1 form that is a record of what happened. And then we'll get to the investigation of what does it actually mean to investigate an incident or accident. Please remember again, you need to keep this for a period of at least 3 years. Now, with all these incidents and accidents, Section 24 incidents and accidents, and any other incident which resulted in the person receiving medical treatment must be investigated by the employer, a person appointed by the employer, by the health and safety representative, or a member of the health and safety committee within 7 days. All right, so now it's telling us what this document is, how we must be using it, and we now want to look at why this is so important. Well, 9.3 says the employer user will cause the findings of the investigation to be entered in the Annexure 1 immediately after completion of such investigation. So it's to keep a record for the company. That's reason number one. The second reason is in the last part of Section 9 of the General Administrative Regulation. So it's 9.4. Every record, so every Annexure 1 must be examined by the Health and Safety Committee or section of that workplace in its next meeting. So it must ensure that necessary actions, as may be reasonably practicable, are implemented and followed up. Why? This is obviously the main reason why we have incident and accident investigations, is to prevent the recurrence of such incident. So this is really what this document is going to help us with. Once we have that document, we then hand it over to the safety department. Maybe you don't have a safety committee, you don't have a health and safety rep, it's just a few of you in the company, or then you can discuss it as a team, your employer and employees together. You will then discuss the results of this investigation. And what you want to do is look at the actions that are being put in place in order to prevent the recurrence of that incident. Why is that? Well, obviously, preventing the recurrence of any incident is vital in ensuring our staff stay safe as well as healthy during their working environment. And again, a staff member, an employee is off because they are injured or off because they are sick is not a productive staff member. So it goes along with production. Having any person at work that is not feeling well, again, is also not going to be productive. So our ultimate goal here is, first of all, the health and safety of our staff, the health and safety of employees. And as our OPSA, we thrive on the health and safety of its members. In fact, it extends beyond that because we want every single human being to be healthy and safe during their working environment. And then preventing the recurrence of incidents and accidents. So let's actually take a look at this document. So this is the document on the left-hand side. This is what you will be able to download. You'll see it's an Annexure 1 form. It is directed to us by the Occupational Health and Safety Act, and that is through one of its supporting regulations. That is the General Administrative Regulations. Here, in particular, we are looking at this document coming from Regulation 9, which we've just discussed. So it is the recording and investigation of incidents. Now, as we mentioned, there are 4 parts to this document. Part number 1, or part A, is the record of the incident, or what actually happened. Part B is investigating. So now not just what happened, but what was the cause or the reason for this happening. Part C is the action taken by the employer, and part D is the remarks or comments by the OHS committee. So it's very simple to fill out. It's a 2-page document. You follow the items as you see in part A, question 1 to 13, and you fill in that necessary information. This could be things like the name of the employer. So what is the company's name? The name of the affected person would be the person who got injured, who got sick. The ID number of the person who was obviously injured or sick. The date the incident occurred and the time the incident occurred. Now, if it was an injury, we just want to take a look at the part of the body that was affected. Was it the head or neck? Was it eyes? And you can choose multiple. Obviously, it's not just choosing one. You could choose multiple. So you could put head, neck, arm, foot, and trunk, and then you would also include multiple. Now, that was the part of the body affected, but what was the effect on the actual person? So now we need to know what actually happened. Was it a sprain or a strain on the body? Was it a contusion or a wound? Was it a fracture? Was it a burn? Now, if you think to yourself, well, I don't know, how am I supposed to know this information? Well, if the person received medical treatment, that first medical report that you are going to receive after you send the person in to have medical treatment will then tell you what actually happened. So if you are not 100% sure, all you know is that the part of the body, let's say the foot, was hurt, but you don't know whether it was a fracture or what actually happened, you can then just wait for the first medical report to come out and get that information from the doctor to add to this document. Remember, you're not taking this document and handing it in anywhere. You're not going to send it to the Department of Labor. That is a separate COED or FEM report. So if you're going to claim for COED or you're going to claim for compensation or medical treatment, that's a separate document. Those are WCL forms or FEM form 2, and you're going to have your own online Coetzee registration where you're going to then try and get compensation for the employer. So those WCL forms, that's what you're going to hand into the doctor and send through to the government. The Annexure 1 form is your own internal record and your own internal investigation, as we'll see. But you also want to find out what is the expected period of disablement. Now, disablement, if that is not applicable, you just leave it blank. And that's for any part of this. So let's say the person didn't get injured, they just got sick. So no part of their body was affected, there was no effect on the person, there was no expected period of disablement. Then you have number 9, the description of the occupational disease. So let's say they got COVID-19. Well, then you would add that in. They got COVID-19. Then 10 is the machine or process involved, or the type of work performed, or the exposure. And you'll see the little 2 asterisks that you see on the end of exposure. That is obviously for hazardous biological, hazardous chemical substances that was being used. And you'll see it on page 2 right at the top. It asks you for a bit of an explanation of what were they actually exposed to. Now, the next 2 questions. Was the incident reported to the Compensation Commissioner? Now remember, you might have an Annexure 1 document that does not form part of a Section 24 notifiable incident or accident to the Department of Labor. So then you would just tick no. But if it was reported, please, and this is something that we cannot stress enough to employers or those handling incidents and accidents, if you say yes, it was reported, please have those supporting documents attached to this Annexure 1. You see, the record of the WCL form, the first medical report, the second medical report, the interim medical reports, the follow-up reports, all of that should be compiled with this Annexure 1 form so that it becomes a pack for that incident that occurred. So please remember, if you do report it or any other supporting documentation, you should keep it with this document. And because this document needs to be kept for 3 years, it would be a good idea and a suggestion from our side to then just scan and keep this as a digital copy. Paperwork can get lost, it can get wet, it can get torn up, it can get lost. We don't want that to happen with incident and accident forms. And the reason for that is we'll see coming out in Part C and Part D. The last one is, was the incident reported to the police? If so, then you do need an SAPS office or reference number that must go along with this document, please. And that is if somebody's killed, if there was a vehicle accident, perhaps inside our premises, that you would also need to include the SAPS reference number. Now, as we mentioned on the second page, you will have that document where it tells you to have the hazardous biological agents, and we will put that in there. But please remember, again, just as a reminder, what incidents and accidents are you recording on this document? Any incident or accident in terms of Section 24, or any other incident which resulted in the person concerned having to receive medical treatment. So there at the top of page 2, in case of hazardous chemical substances, what were they exposed to? So that's where you would add in the exposure to certain chemicals, certain diseases, or workplaces that they were exposed to. So just a very big thank you to Rudy Glock, who sent us that information on carbon monoxide, which will be coming out in next month's Toolbox Talk. This then would fit in to that case scenario where you would have an Annexure 1 form recording what actually happened with that employee who succumbed to carbon monoxide poisoning. All right, part B is the investigation side. So remember, we said the investigation in terms of General Administrative Regulation 9.2 must be investigated by the employer, a person appointed by the employer. So it could even be a consultant like ourselves. It can be the health and safety representative or a member of the health and safety committee. Now, this must be done obviously within 7 days of that incident. And you'll notice it also finishes off by saying it should be finalized as soon as possible. And in terms of contracted employers or contracted workers, so if you've contracted them for a certain period of time, that incident or accident must be finalized by the end of their contract term. So the B, investigation, the name of the investigator, the date of the investigation, the designation of investigator. Are they the employer? Is it a person appointed? Who are they? How have they been appointed? Have they been appointed as the incident investigator in the safety file? Are they the health and safety rep or a member of the health and safety committee, perhaps an advisory member? Then you want to put a short description of what occurred. And there you can obviously ask for eyewitness statements. You can ask the injured person themselves. Try and do this in a good manner. We've got an entire course on incident and accident management coming up for you during Prime. So if you're an IOPSA member, it is a course that you do not want to miss. Then what is the suspected cause of the incident? This is where we want to try and use a little bit of root cause analysis, try and find out what actually happened, but why it happened. And really why it happened, not the person was to blame. Why was the person to blame? Is there some sort of procedure or policy in place? Is there some sort of training missing? Most of the time with incidents and accidents, we can find out that there's a process that's not being followed correctly within the company, not necessarily the person to be at blame. So this could be somebody falling off a ladder, but they've never been trained to use a ladder. And we say, well, everyone should know how to use a ladder. Well, that's not really the case. The law says you need to train. And that's why we have Toolbox Talks like this every single week. It's those repetitive reminders that help us to keep safe. This is something we should also be following within our own companies. Then the recommended steps to prevent a recurrence. Now that recommendation coming from the employer, the person appointed, a health and safety rep or the health and safety committee member, they will then say, based on their knowledge of the issue, this is what they recommend to prevent the recurrence. They will then sign it and put the date, and then it is handed over to the employer again. So if the employer is the one who filled it out, they just go directly to the next section. If it is a person appointed, a she rep or the health and safety committee member, they then hand this document to the employer to fill out part C. That is the action taken by the employer to prevent the recurrence of a similar incident. Now, how do you prevent something? Well, it is based entirely on the incident. Let's say somebody got COVID. You might say, well, we sent them home. Well, that doesn't prevent the recurrence of a similar incident, not with the same person, but a similar incident within the company. That's what you're actually trying to prevent. So how do you do that? Well, it's by implementing your proper protocols. So these incidents and accidents might change your risk assessment, might need an additional policy. It might need an additional safe working procedure, because the prevention of an incident or an accident may mean additional training, may mean an additional process that needs to be put in place and then constantly monitored to ensure that it is effective. This document then is handed over to the Health and Safety Committee. Now, as we mentioned, if you do not have a Health and Safety Committee to fill out sorry, I've already skipped ahead there, to part D, is they will then take the whole document, they will read parts 1 to 3 and find out what they can do to assist the employee to really help them to prevent this from recurring. But the question is, what is if your company does not have an OHS committee? Well, then it can be discussed between the employer and all the employees. Remember, if you don't have a health and safety representative, you've got less than 20 employees in your company. So if an incident happens that you need to fill in one of these documents, you don't have many employees to be able to sit down and have a meeting with. If you have more than 20 employees, well, then you can have this sent over to the health and safety representative, who will then maybe discuss it with the employees and themselves and give the employer a report back. But what we really want to do is have as many people as possible involved, not so that we can point fingers to anyone, but the more people we have involved in this type of system, the more impact it will have on the health and safety management of the company, because each person involved will see what happened, why it happened, and what they can do to prevent the recurrence of that incident and accident. And that's really what you're trying to achieve in a company, getting everybody on board, everybody on the same page. So as we mentioned, we always want to give you templates. Now, the Annexure 1 document is a government template, so it's not customizable to your own content. We can't change any of the parts or the questions. So we can only give you the actual document from the Department of Labor. But please use this form as it is, and please ensure that you keep it for 3 years. Remember, as a reminder again, which are the incidents that we are looking at. Any incident in terms of section 24 and any other incident that the person received medical treatment other than first aid. So we hope that helped you this morning on an Annexure 1 document. Perhaps you've got WCL forms that you've been filling out and you've forgotten about the Annexure 1 form. If so, you can go back and start filling this in. Why? Because your WCL form is only a report to tell the Department of Labor what happened. But the Annexure 1 form helps us to internally find out what happened and try and prevent the recurrence of this from happening to somebody else in the company. So it's what we call incident management. And again, it goes along with our safety thought. You can prevent incidents and accidents and prevent the recurrence of incidents and accidents by just planning ahead. So please go ahead and take a look at any incidents and accidents that have occurred that fall within this scope, to have an Annexure 1, get those Annexure 1s in place, and start now from preventing those incidents and accidents from recurring. Now, next week, we're going to look at legal appointments. How are these done? Where do they come from? And what are your main legal appointments that we're looking at? We also have a lot of templates for you for this, but we're not going to cover every legal appointment, just your basic ones that you'll use for inside a company, or perhaps you're working on site, and we'll touch base on normal OSH Act appointments, as well as your construction regulation appointments, your general safety regulation, as well as your general administrative regulations. So we look forward to seeing you next week, and we want to say a very, very big thank you to all of you for taking the time out to listen to this Toolbox Talk, and we're going to hand it over back to you, Karim.
Thank you very much, Chris, for this informative session. I believe there are no questions from my side. Is there anything you'd like to add before I end off?
Just once again to yourself, Karim, for always assisting us for these Tuesday morning Toolbox Talks, as well as to all our ops members. A very big thank you to you for taking the time out. If you are a SIOSH member, don't forget that you can claim 1 CPD point for every single Toolbox Talk. And if you are a PRB member, you can claim 1 CPD point for attending all 4 of these Toolbox Talks for the month. Thanks again.